the largest muscle of the body is the gluteus maximus. Okay, it's right on top. It's easy to touch and feel. All right. What you need to do for this is the main action here is extension, right? So, can you bring this leg up? Not just this whole thing, and you could feel it. I want you to palpate it, okay? Now, the underneath it, like right in this area here, would be the gluteus medius. Obviously, it's under the whole thing, but it sneaks through a little bit right over here, okay? And gluteus medius has to do with internal or medial rotation. Now, medial rotation, the leg, his leg is going like that, and let me see 1 second. Yeah, you're pressing this way. Press into my hand. No, press into my hand. All right. So when he presses into my hand this side, it's medial rotation. The thigh is rotating this way. So press in against pressure. Let go. Press in. Let go, and you could feel it right here. The gluteus minimus is underneath all of them. It's too hard to palpate, okay? You could try, press. You can feel it a little bit, but you're probably feeling the gluteus medius more than anything. All right, the other one is your tensor fascial lata. Now, the tensor fascial lata comes from the ASIS to the gluteal tubercle, which is the iliac tubercle, which is right around here. So it's right in this area. Again, medial rotation. It's the same as the gluteus medius. Press in this way, and you could feel it in here. Okay. All right. So that takes care of those. Now, all of the lateral rotators are the piriformis, the two glomeruli, inferior, superior, and the obturator internus. All right, and then the quadriceps femoris. The quadriceps femoris comes from the gluteal tubercle, so palpate for the bone, the sits bone right here, and it goes to the trochanter, which is right here, okay? So it goes from the gluteal tubercle to here. And again, this does lateral rotation. So lateral rotation, if you're going like this, press in. No, it's the other way.
Wait,
no, that's
I'm
In.
confused. Wait,
no,
lateral isn't it this way?
No, medial is out, lateral is in. So press
because
in.
It's the whole thigh. It's not.
It's this. It's from here to here. It's from the. I'm going to say the elbow, but it's from the knee to the hip. Press in. Okay. So now you're going to feel in here to contract. Do it again. Relax. Contract. And I can feel it right here. This muscle right in here. Okay. And then all the others do the same thing. So palpate in. First of all, to find the piriformis, get the PSIS. Okay, how do we find the PSIS? Get his iliac crest. Look how high his iliac crest is to his waist. All right, on the men they're longer. So it's up here, and palpate down, and here's his PSIS right here. Okay, so from the PSIS to the coccyx, get the trochanter, and you intersect. That's where the piriformis is. Okay, that's the way the piriformis goes. So you're going to palpate here, bring your leg up, you're going to press into me, let go, press, and you can feel it, and follow it down. Okay, that's the piriformis. All the others are the same too. So the glomerulus, do it again. Yeah, you can feel all the glomerulus and obturator foramen, all this area in here. Okay, so that's all of those muscles. Now, we're in the back here, so let's do the hamstrings, right? What are the muscles of the hamstrings? There are 3 of them. Biceps femoris. All right, the semitendinosus and membranosus. The semitendinosus and membranosus are on the medial side. The biceps femoris is on the lateral side. The biceps femoris they all attach into the ischial tuberosity, all of them. Okay? Now, the biceps femoris comes down and attaches into the head of the fibula. So when you're trying to find gallbladder 34, it's in the neck, just below the head of the fibula. So the fibula is hard to find on a lot of different people, because some people have big calves, and you just don't know where to find. You know, it's not an easy bone to find. So what I recommend, bend the knee, okay, bend the knee, and feel that tendon, that tight tendon, that's your biceps femoris tendon, right in here, lateral. Follow that tendon, and that'll go right into the head of the fibula, okay? Then what you do is you follow that head of the fibula around, and you'll fall into a little ditch, and that's your gallbladder 34, okay? But anyhow, we're looking for this is the biceps femoris. Now the biceps femoris, like the semitendinosus and semimembranosus, flexes the leg, flexes the from the knee to the ankle. So you're going to press in, and you feel them. Here you see, you feel the semitendinosus, and try to feel the difference between the tendinosus and the membranosus, okay? So on top is the tendinosus, right here is his membranosus. And you follow it down to right here, you'll feel where the two of them come together, and there you're going to find this kidney 10 and liver 8, okay? Liver 8 is a little more anterior, kidney 10 is more towards the back, and but it's right between those two tendons, okay? All right, so feel for that with the flexion, all right? So now we did that. Let's turn you over on your back. All right, so what's the muscles of the front compartment, the anterior compartment?
Rectus femoris.
Yeah, but what's the group called?
The
Quadratus femoris.
Yeah, because
right?
the back is the hamstrings and the front
the quadratus femoris, okay? So, last week we learned that we found the the AIIS by finding the tendon of the rectus femoris because it goes over both of the joints, the knee joint and the hip joint, okay? So, if we bring this up, bend it a little bit, press into my hand, and you could feel right here, is that tender? Oh, sorry, my bottom?
No.
Okay. Right in here is the tendon, and that right underneath that tendon then is where the ASIS is, all right? So, okay, so there we found that. Now, this extends, so press into my hand, and you're going to feel in here. So this would be your vastoid medialis. This would be your intermedius. It comes right. Oh, I'm sorry. Tickle. I'm sorry. Okay. The big tear-shaped. Okay. It's your medialis. Underneath is your intermedius, and then on the side, press up, is your vastoid lateralis. Okay. Now, the only thing we didn't do, but I'll do it when we're sitting up, is the sartorius, because it comes from the ASIS, which is, on him, where is it? Right here. It comes like this, it comes down, and it comes underneath onto the tibial tuberosity, the tibial condyle, okay? The medial tibial condyle, all right? What also attaches into this medial tibial condyle is the gracilis, which comes along here, okay? So, now, actually, we could do it this. Bend your knee. Bend it over like this. Okay. And press up. And you should be able to palpate. Yeah, you feel it. Feel the muscle. But it's probably better when he's sitting. Okay, but this is the sartorius. You should be able to feel the sartorius. Okay? All right. And actually, you feel his gracilis coming in, too. All right. Pectineus does adduction and medial rotation. So now with this leg, go over like this, like you're crossing your legs. And that's right at the it's on the pubic crest, it attaches. Resist me. And you can feel it in here.
Which one is that one?
The pectineus.
Pectineus.
Okay? Now, also you have, down in this way here, you have the adductor longus. Okay? Again, press in. And right in here is his adductor, I'm sorry, he's ticklish. Adductor longus right in here. And then right here is the triangle. So right in here is your femoral artery nerve and vein, and the lymph nodes, the inguinal lymph nodes, okay? All right, so underneath that adductor longus is your adductor brevis. You're not going to find it, don't worry about it, okay? And the gracilis is in back. So basically, if we were to turn them over one more time, I'm not gonna do it now, I'll go around to all of your tables, but it does extension, so you put them into extension when you're doing the hamstrings, and you'll palpate, right, it's medial posterior, okay, so, but it's sometimes considered part of the hamstrings, it's the addition to the hamstrings, so it does do extension with the adduction, okay? So basically that's it, and then once you get that all together, if you have any questions on palpating the pelvis or palpating the spinous, interspinous spaces, we'll go over that again too. All right? So get this all done. I'll go around to all your tables. I want you 2 and 2 and 2. Okay? So let's see how you do. Okay?